Like the last motion, this one deals with the real life struggle of so many American families. It may be a family with a sick child or a disability who suddenly find themselves facing bankruptcy because of their lack of access to our healthcare system. It may be a senior with Parkinson's in a nursing home, or it may be a young woman who needs breast screening, a mammography, to avoid a threatening health condition. The last debate we had about this health care issue is as if the people who sit around this table came from different planets. At least they come from very different life experiences. I see the people that we're talking about. I talk with them. I interact with them. I have a senior come up at a neighborhood office hours and tell me that the state Medicaid program will cover only 3 of the 5 prescriptions that the doctor said were essential to their health care. We were told by our Republican colleagues in response to the last motion, don't worry, it's a phony number that 400,000 people will be denied health care because we plan to repeal all the Affordable Health Care Act and they wouldn't have gotten coverage anyway. What kind of a response is that? And then the suggestion of all they're really doing is they're just kind of scrubbing it down. They're just going to eliminate the waste. They're going to eliminate the fraud in the Medicaid program. Well, there has been fraud in the Medicaid program. Some of the most significant fraud has been by pharmaceutical manufacturers in our state and across the country. And I think we ought to do everything we can to prevent that fraud. But why should the woman who needs breast cancer screening, the child who needs diabetes screening, the child who needs an immunization, why should they pay for that fraud that we haven't done enough to ferret out? And so we get to this motion and the whole idea of trying to reduce health care costs, and I think it's a significant part of the Affordable Health Care Act to reduce long-term health care costs, not only by trying to limit some of the growth in the expenditures, but trying to prevent the need for the health care service in the first place. I've been to a number of events recently where I have seen individuals who have severed limbs, in some cases more than one severed limb, and are in a wheelchair. And it's because their diabetes got out of control, because that diabetes wasn't prevented. Diabetes is almost at an epidemic stage in some parts of Texas that I represent. And this motion is about trying to prevent conditions like diabetes before they get run away, before they cost us even more money in hospital costs, in lost productivity, not to mention the lost joy of life of being able to get around. I was just this past weekend at the Coleman Race for the Cure, a gathering in Austin, Texas, and we'll have thousands of people out this Saturday in San Antonio. So much of the focus of that Race for the Cure is about prevention. It's about reaching out and helping women get the care they need before they might develop some form of breast cancer. That's what this motion is about assuring the resources for prevention. And the Affordable Health Care Act, it was the American Cancer Society that said a person who lacks health insurance and who develops cancer, whether it's breast cancer or some other form of cancer, has a 60% greater chance of dying than someone who has insurance. That's what the Affordable Health Care Act, of which this prevention part is a piece, is all about. And then there's the question of how we pay for it, because we do pay for this motion. We have a number of provisions in our tax laws that favor the export of American jobs. And through this motion, Ms. Schwartz closes those tax loopholes and pays for prevention by preventing the loss of American jobs. We have a terrible problem with the export of our intellectual property because of the incentives for loopholes and tax dodges that our tax code provides there, and some of those loopholes can be closed through this. I yield back and thank you for your leadership.